We acknowledge that we are on Treaty 6 territory, the gathering grounds of many diverse First Nations, Métis, and Inuit peoples whose footsteps have marked this land and whose presence continues to enrich our vibrant community. Hello and welcome back to Research Recasted, the Knowledge Mobilization Podcast. I'm your host, Kelsey Johnston, and today we are joined by Dr. Janet Kemei. Dr. Janet Kemei serves as an assistant professor at the Faculty of Nursing at MacEwan University. She is an internationally educated nurse, originally from Kenya, who has resided in Canada for the past 16 years. Well, hello, Janet. Thank you so much for joining us today.
Thank you. Thanks for having me.
Yeah. I was hoping we could start by getting you to give us just kind of a brief overview of the research that you do here at MacEwan.
Okay, so my research is about maternal and child health, and also I've started delving into youth. So I look at the health inequities and also the well-being of mothers and children, and mostly around perinatal care. Perinatal care is, any time from when they just before they get pregnant up to maybe around 12 months after the baby has been born. So that's basically where my research is around.
Okay, so looking at mothers, children, and especially in that sort of time where people are trying to get pregnant up until they have the
baby 12 months after. And then also it's not only about health, it's also the well-being, so also the mental health. Yeah.
Amazing. What inspired you to research these inequities that you found in this type of healthcare?
Okay, so actually, it's an interesting story. So when I was in my second year as a nursing student in Kenya, because that's where I did my first degree, there was a lady who was pregnant, and they had gone to the market. They were coming back from the market, and they were having a baby just right by my house. So my friend came rushing because they found her. She was really laboring and the baby was almost coming out. So my friend, knowing that I was doing my nursing course, she came rushing to me to go and help deliver the baby. So of course we didn't have the PPEs, we didn't, but we did the best that we could because the baby was coming out anyway already. And also the nearest health center was like 5 kilometers away. We did not have 911 where we can call, for help. So we just had to do it. So I delivered a baby in my second year just after serving in clinicals. I had not done it. That baby is well and alive. So that's great. And so that kept me thinking, why was this pregnant woman who was almost delivering going to the market? And is there anything that could have been done differently? So that's how I started thinking about the maternal health research.
Oh, wow, that's actually a really incredible story, just having to deliver a baby, like, outside on the road.
Yes.
Right?
Yes, on the road, like, we had to improvise everything. We did not have PPEs, but I just used my theoretical knowledge to just try and help this woman and the baby.
Well, it's amazing that everything worked out and the baby's alive and well. And I mean, if there's anything that'll make you inspired to start doing research, that would be it. So let's talk about that research, because you do a lot of work with prenatal and youth and especially like well-being and mental health. And you have been a part of a couple projects, specifically when it comes to Black youth and access to mental health and addiction services. And I was wondering if you could kind of sort of just explain some of this work to us.
Okay. So when I moved to Canada, I was pregnant, and I did have a chance to use healthcare services, and during that time, I figured out really what was going on in Kenya was not as much different as what was going on here, because I was having some difficulty accessing those services in terms of, knowing where the information are. Because like when we came, no, we did not have anyone to show us, how do you access a doctor, and like we had to go to the internet and try to figure this out myself. So that kept me thinking I need to continue with my work here, because if I was able to have those barriers myself, and I was able to read, right? So how about someone who is not really aware? I was able to utilize the healthcare system, and I saw the interactions that I had with the healthcare professionals, and I kept thinking this cannot be happening to only me. So right now, I know you asked about the youth, and mental health of the youth. The reason why I went into that is I have 2 sons, and I can relate to Black youth, because I see what my sons are going through. I'm not saying they have mental health issues, but I know they sometimes they have difficulties around accessing some of the healthcare services. They come to me, they ask me, we had this in school, how are we supposed to, really access these services? So with the youth that we are working with right now, these are, I would say, they are vulnerable youth that we have. They've had access to mental health services within the communities, and we are trying to figure out how can they really leverage technology, because, with ChatGPT, all the youth, actually, that's what came up when we were doing focus group discussions. The youth were like, better off just, typing my question to ChatGPT, because I get instant feedback, right? So we know that ChatGPT doesn't really, it's not human, right? I mean, they have some answers, but it's not human. They cannot relate. They don't have that emotions. So how can we ensure that the technology, whatever our youth is accessing, is really what we want them to know? I mean, is really what's going to be helpful to them, whatever decision that they're going to be making, right? So that's why we were trying to see how we can use technology to ensure that the youth are really accessing the necessary information from the internet.
Yeah. What sorts of technology were you trying to use? Because you mentioned ChatGPT, but we all know that ChatGPT makes a terrible mental health therapist sort of resource. Yeah. So what alternatives were you looking at?
So we are looking at, knowing the youth, knowing really how to access the reliable sources. Okay. So, for example, Alberta Health Services, for example, Canadian Mental Health Association, the reliable internet sources. That's what we are really looking at.
Yeah. Okay. No, that's really great, because again, mental health doesn't immediately say that you have mental health problems, but you said it at the beginning. Mental health is all just about well-being.
Exactly.
So I think it's really great that there are people looking out, especially for children who may not know, and youth who may not know, or they only know like a certain way of doing things. You've also done some work about access to mental health services by Black women in Alberta. Can you kind of explain that for us?
Yes. Yeah, I did that. So what we did first is we were doing it as a team. That's why I'm saying it's we. Yeah. So what we did was we did a scoping review first to try and find out what literature is out there around mental health for Black women. Okay. And with that scoping review, we did a scoping review for all Black women in Canada. And then we did some interviews with women in Alberta now to see how they are accessing mental health. Are there any barriers? Are there any facilitators to their access to mental health? So we did interviews with around 20 women. They were in-depth interviews, and we got a lot of information around their access to mental health. I'd like to say we had to change one of our questions because mental health is seen as there's a lot of stigma around mental health when it comes to the Black populations. So we had to change one of the questions to just health. And then ask questions around mental health, because when we said mental health, we did not have any participants coming forward to talk about their mental health access. So yes, so we found a lot of information around their access and barriers, and it's unfortunate to say most of the information that the women were talking about was barriers, how they were not able to access the mental health. And it was mostly barriers around stigma. As I mentioned, mental health is seen almost as a taboo within the Black community. And I just wanted to clarify, when I talk about Black communities, that we are not an homogeneous population. Right? Yeah. We are different, and we have Black women who are born here in Canada that might not have the same experiences as Black women who have immigrated to Canada with their own different beliefs from wherever they came from, right? So, so I just wanted to say whatever I'm going to be talking about doesn't really generalize that to all the Black women, but it's really to this population that I interviewed, but it could be applicable to other Black women. So, so I mentioned issues around stigma. I mentioned issues around financial health, financial barriers, in a sense that they were not able to access some of the mental health services because they needed to pay out of pocket. Their insurances could not cover for that, so they were not able to access that. The other issue that they had was not having a mental health practitioner that looked like them, that made them know that they understand what they're going through. So that was another issue that they had. And the other issue that they mentioned was how they were being, how they received the services, how they were being treated when they went to access the mental health. They found that they the healthcare practitioners were not really taking them seriously about their conditions or their symptoms that they are trying to explain to them. And
it's tough to hear about how many barriers there still are, especially like in today where, but I also realize that mental health does carry a large amount of stigma around it. Have you done or looked into or just know of any ways that women and youth can kind of get around these barriers? Are there anything that they can do?
Yeah, so we have raised some implications on what we can do to help with that, and I just wanted to make to explain that having the services available doesn't mean that the populations are going to be using those services. Yeah. So it's really about the accessibility, right? So if we have services available, is that is the population using those services? So what I would think is if we can look at the flip side of the barriers, right? So, for example, the women are talking about they don't have a healthcare practitioner that looks like them that they could really go and access those services with them. So, if we can have more, you know, Black healthcare practitioners, or at least people who understand the Black culture, right? So that we are giving culturally sensitive care to these women, like a health practitioner doesn't have to be Black to be able to be culturally sensitive, right? Like healthcare practitioners can learn and understand the Black culture and how mental health is being perceived within these communities. The other aspect is really having these mental health services maybe being covered by the maybe the provincial insurance, or even being subsidized, so that people are able to afford psychologists, for example. If you're going to a psychologist and you don't have insurance, right? Like people like me, we are lucky because we have health care coverage that would cover that part, right? But there are people who do not have that. So I think having the services accessible is very important, and also not just the services, thinking about culturally sensitive services.
Yeah. I know I've interviewed quite a few people who kind of delve into the world of mental health and everything, and I know that accessibility is a huge issue that everyone is facing right now. So it's really great to see that people are actually doing work into that. I do want to ask about one more of your projects that you had kind of brought up before, that's exploring the aesthetic expression of being a Black nurse. And I was wondering if you could kind of talk us through that. But first and foremost, kind of what do you mean by the aesthetic expression?
Okay, that's just a fancy word for physical expression. So what we did actually was, so we did body mapping. So it's an art. So we had artists, which are now the Black nurses. They came in and we had like canvases, and they laid down, and one of us took an outline of their body. And then now these nurses went in to do some painting on that outline of the body. So it's body mapping, right? So what we ask them to do is think about yourself at work. Think about what you're going through. Think about the emotions that happens, when you're at work, or even when you are not at work, but it's related to work. So they painted, and then we asked them to do, to make a logo. So a logo, right? Of or make a thesis statement about what they've painted. So they did that painting for the first part, and then now for the second part, we asked them to explain. So before we asked them to explain to us what it is, so as researchers, we sat down and individually we tried to interpret their drawings.
Yeah.
And then later now we asked them to come and explain to us their drawings, what was going on in their mind, why is it that they had these colors and all those colors. So it's just, it's a cool way of really trying to get information with less stress, because most of the time when you talk to Black nurses, they have undergone a lot of stress at work in regards to, biases, racism and all those stuff. And most of the time when you ask them directly to tell you that, they might not, because of the emotions, they might not really have you might not really get exactly what they want to tell you, in a sense that they get emotional, and but when they have this chance of drawing it, and kind of like what we do with children sometimes, right? They do the drawings and all the stuff. So when they draw, they get to reflect, and once we start when we start meeting with them, we met with them like 2 weeks after they did the drawing. So all the emotions have really settled, and now they're really able to tell us exactly what is it that they were thinking at that time. It's still work in progress. Yeah, so we are still doing the analysis. We don't have the final themes yet about that project, but we've met with the nurses, and we generally have an idea of what's going on within their work environment.
That sounds like a really fun but also beautiful way of trying to get information.
Yes.
This idea of body mapping. I've never heard of that before, but it'll be really exciting to see what comes out of that once you finish that.
Thank you.
Right. Now, I think you've kind of touched on it a little bit throughout our conversation today, but I really just want to ask, why is this work meaningful specifically to you? Like, what motivates you to do this?
So this work is really meaningful to me because I want the best experiences for Black women, children, and youth. Same as I would want best experiences with anyone, right? But it's just that this is where I specialize. It's meaningful to me because I'm a Black woman, as you can see, and I have children, I have youth. I have gone through the experiences that I'm trying to research, right? So I'm a Black woman. I've accessed healthcare services during perinatal care when I was pregnant and after I got my baby. And I want to help contribute to the well-being of this population that I'm looking at, so the Black women and children and the youth. I want to be part of that solution. I'm hoping that my work will inform policy. Because at the end of the day, we want to look at the root causes, right? What's really causing these problems and how can we mitigate it? And the best way to do that is through policy. So I'm hoping that my work will continue to contribute to policy. I know we did some work with COVID-19, and some of that work was used in looking at policies around health and well-being of Black people. So which is great, but it's an ongoing process. But the alternate is really ultimately we want to see that the health and the well-being of the Black populations has been improved in Canada.
All right. Before we finish up here, is there anything else you wanted to mention that we haven't already touched on?
I think we've touched on most of what I needed to say generally. But I think the most important thing is we still need to work on. We still have a lot of work to do around the health and the well-being of the Black people. We've come a long way, but we still have more. There are many other issues that I haven't talked about here. But they intersect to contribute to the health of the Black populations, like things like employment, education, looking at the institutions, because we play a big role as the institutions in regards to the well-being of the populations that we have. These policies that we are working on changing, it's not only for the healthcare system. It is really policies that touch into other institutions, right? Like schools, the environment, the community, what's happening within those communities, the housing, employment is very important because that determines the income, right? And just talking about the income, we know that the population, especially the Black immigrant population that we have here in Canada, they are well educated mostly, right? But why is it that their income is low? So we need to look at those structural issues, really, because at the end of the day, it contributes to the work that I'm doing. If they don't have good income, then they're not able to access the mental health and healthcare services that we look at, right? So not looking at it from only one side, but understanding that health does not belong only to healthcare, right? That we need to look at other sectors, the environment. We need to look at the built environment, the neighborhoods that people live. I know we had studies in Toronto during COVID-19, and COVID-19 was disproportionately impacted the Black populations. And one of the issue was they were not, the areas that they lived in, they didn't have spaces that they were able to go and even walk around while social distancing, right? So people intergenerationally living in the same rooms and infecting each other, and so all those things needs to be looked at. It's not only the health sector.
Wow. I want to thank you so much for joining us today and talking us through your research, and it'll be really interesting to see where it goes and what the outcomes are of your projects that you're working on. So thank you.
Thanks for having me. Really appreciate that.
Of course. Well, that's all we have for today's episode of Research Recasted. If you want to support this podcast, you can visit Research Recasted on your favorite podcast platforms to find new episodes every 2 weeks. Also, don't forget to check us out on Instagram at Research Recasted, where you can give us a like, leave us a follow, or send us any follow-up questions you have from today's episode. This has been Research Recasted, the Knowledge Mobilization Podcast, brought to you by the Office of Research Services and the Faculty of Fine Arts and Communications at MacEwan University.